everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we are going to be talking about nursing diagnosis. In our previous class, we gave a brief introduction of what the nursing care plan is all about and also the various components of the nursing care plan. But today we're going to be talking about nursing diagnosis, the various types of nursing diagnosis, how to derive our nursing diagnosis from a particular question, and we're going to be giving examples at the end of this class. So I advise you stay to the end. But before we continue, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about nursing diagnosis. What is nursing diagnosis? Nursing diagnosis is a clinical judgment. It is what? A clinical judgment. God's right. It's a clinical judgment, not a law judgment. It's a clinical judgment about what? An individual, a family, or a community in response to potential or actual health problem. It is what? It is a clinical judgment. Take note of those two words. Clinical judgment about an individual, family, or community in response to what? Potential or actual health problem. Then that takes us to the types of nursing diagnosis. We have two types of nursing diagnosis. The first one is problem focus or actual nursing diagnosis. It is what? Problem focused or actual nursing diagnosis. What is second is the risk or potential nursing diagnosis. The what? The risk or potential nursing diagnosis. Let's begin with the first one, which is the problem focus or actual nursing diagnosis. The problem focus or actual nursing diagnosis is also known as the theory statement nursing diagnosis. It is also known as what? Theory statement nursing diagnosis. It is problem focused, actual. Why? Because on assessment, when a nurse is assessing a patient, the nurse sees this problem. The nurse noticed this problem. It is not what the nurse envisaged will happen. It has already happened. The signs and symptoms are obvious. You are seeing it. So that is why it is what? It is problem focused. It is actual. It is present in that patient at that period of assessment. And it is what? The theory statement nursing diagnosis. So why is it a theory statement? It has three parts. The nursing diagnosis, which is the problem statement itself. It has the related factor. And it also has what? The defining characteristics. The problem statement is what is the problem? What do you want to tackle? The related factor is the etiology. What is causing that problem? While the defining characteristics is the signs and symptoms. This related factor is what is causing the problem. While the defining characteristics is what? The signs and symptoms. For example, a patient walks into the hospital and there's an obstruction in the airway. As a result of that, this patient can't breathe properly. So we are going to be talking about ineffective airway clearance. We are using the NADA standard, the NADA's weights. So we are going to be talking about what? The problem is what? Ineffective airway clearance. What is causing it? There's an obstruction of the airway. Ineffective airway clearance related to obstruction of the airway, evidenced by the signs and symptoms you see in that patient. It could be dyspnea, it could be grunting respiration. You can see it's a theory statement nursing diagnosis. Ineffective airway clearance related to what? Obstruction of the airway, evidenced by dyspnea or grunting respiration. You can also have acute pain, which is the major diagnosis. Acute pain related to maybe inflammation of the appendix, evidenced by what? Patient's verbalization. Then that takes us to the other type of nursing diagnosis. Second type of nursing diagnosis is a risk or potential nursing diagnosis. Why is it called a risk or potential? Remember, in the actual, we said that the signs and symptoms are obvious. You are seeing it in that patient at the point of assessment. But in risk or potential, the signs and symptoms are not there. You are not seeing it. But you are assuming, oh, if I don't do this, if this patient is not taken care of, the patient might likely go down with this. The patient might likely develop this. The patient might likely develop infection. The patient might fall down. So it's a risk for it. It has not happened. I don't know if you get now. So that is why it's called risk or potential nursing diagnosis. The things are not there. The signs and symptoms are not there. But you're thinking, if I don't do my job properly, there's going to be risk for infection. There's going to be risk for a fall. If I don't put side raise for my patient, there's a possibility my patient is going to fall down. You get? Because my patient is weak. So that is why it is risk. You are not seeing those signs and symptoms of the patient when assessing it, but you are thinking fast as a nurse. So in terms of risk or potential nursing diagnosis, it has two parts: the risk diagnostic label and the risk factor or defining characteristics. The risk diagnostic label: risk for a fall related to muscle weakness, risk for infection related to surgical incision, risk for this related to this. It is not showing. You don't know the signs and symptoms. So what the normal NADA tells us to do is that we say risk for infection evidenced by surgical incision. I know a lot of us must be like, oh, they told us related to this. How come it's not evidence? Yes, that is the new standard. It is evidence. Risk for infection evidenced by this. Risk for a fall evidenced by this. But what I would advise you to do is to follow suit with what your lecturer tells you. But this is a new standard on how to go about your nursing care plan risk diagnosis. There are other types of nursing diagnosis, which is health promotion nursing diagnosis and syndrome nursing diagnosis, but we hardly see that. So the ones that we are more focused on in terms of our exams is the potential and actual nursing diagnosis. Then the big question is, how do I make my nursing diagnosis? When a patient walks into the hospital setting, the signs and symptoms that you see in that patient will determine the nursing diagnosis. A patient having difficulty with breathing, the next thing that should come to your mind is ineffective breathing pattern. A patient complaining of pain, the next thing that should come to your mind as a nursing diagnosis is acute pain. A patient's temperature reading 38, 39, 40 degrees Celsius, the next thing that should come to your mind is hyperthermia. You get now? So that is how we develop our nursing diagnosis. But in terms of exam condition, a question comes to you and it said make a nursing diagnosis. The first thing I advise students to do is to ask yourself, is the signs and symptoms given? If yes, write down the signs and symptoms down. From the signs and symptoms, you will be able to develop your nursing care plan and your nursing diagnosis. Then the next question is, oh, the signs and symptoms are not given. What do I do? Ask yourself, is it an inflammatory condition? Is the cells inflamed? Are they saying itis, laryngitis, pharyngitis? You get? So if it is an inflammatory condition, the next thing that should come to your mind is hyperthermia, pain, and anxiety. Those are the three nursing diagnoses common with what? Inflammatory condition. Oh, there is no inflammation. What do I do? Ask yourself, which particular system is this question coming from? Is it from respiratory system? Is it from cardiovascular system? Is it from respiratory system? Is it from digestive system? Because similar systems, see, some systems, they have common nursing diagnosis that, okay, you can like, let me put this since I don't know the answer in an exam condition. So you can check our Telegram class. We gave a voice note on giving a summary of each system. So that is that for the various system. Then another question you should ask yourself is it a post-op or a pre-op nursing diagnosis? Pre-op, anxiety is usually there, because no matter what the surgery, when you tell a patient you are going to the theater, that patient becomes anxious. Then post-op, we have common post-op nursing diagnosis like ineffective breathing pattern related to the depressant effect of anesthesia evidenced by dyspnea. Then we can also have acute pain related to surgical incision evidenced by patient's verbalization. We can have imbalanced nutrition. We can have risk for infection. These are the common nursing diagnoses associated post-operatively. So we will now try to solve some questions and draft out some nursing diagnoses. Let's do the first question and see. Now, let's assume you walked into the exam hall and you see number one question like this. It says, Mr. Habib, a 52-year-old farmer, wow, presented to the medical ward with complaints of fever, are you following? Anorexia, weight loss. That's how many signs and symptoms I've got now? 1, 2, 3. Weight loss, evidence of systemic embolism, cardiac murmur, as well as splinter hemorrhage under the fingernails. He was diagnosed with effective endocarditis. Develop a nursing care plan to solve 3 nursing diagnoses. There's something I want you, just follow suit. Don't just concentrate on what I'm doing now. So you got into the exam and you see something like this. The signs and symptoms are given, right? It is obvious. So what you just have to do is a giveaway. Pick all the signs and symptoms. We got what? Fever, we got anorexia, we got weight loss, and we got cardiac murmur. From this, if I'm in the exam hall, this cardiac murmur, I can likely turn into ineffective breathing pattern, because this cardiac murmur might cause difficulty with breathing. There's fever, that's to tell you there's going to be what? Hyperthermia. Are you following now? There's anorexia and weight loss, that's going to already tell you that there's what? Imbalanced nutrition, less than body requirements. Do you get? So we're having what? Cardiac murmur, fever, anorexia, weight loss. From this, we have been able to what? Derive our nursing diagnosis. Paraventure, let's assume these signs and symptoms are not given. And finally, you saw infective endocarditis. You can't kill yourself. Maybe you don't know what infective endocarditis is all about. But remember the rules. We are not leaving the book blank. And you see endocarditis. In sake of exam, what you have to do is to solve for hyperthermia, is to solve for pain, and is to solve for anxiety. When these signs and symptoms are not given and you don't have any idea, so you solve for what? Hyperthermia, pain, and anxiety. Paraventure, the signs and symptoms are closed up. Infective endocarditis is not given. What was given was a condition related to the heart. You get? Maybe they gave you endocarditis. You've not heard of you know that endocardium is in the heart, but you don't know what it's all about. But you know this question is from cardiovascular system, which is the heart. So for me, anything that affects the heart affects our breathing. So if I'm in the exam hall, I can't be stranded. I can't leave the book blank. So I'm going to write ineffective breathing pattern, acute pain, and anxiety, because ineffective breathing pattern, acute pain, and anxiety are common with the heart disease condition. Check. Angina pectoris, you have that. Myocardial infarction, you have that. Coronary atherosclerosis, you have that. Hypertension, you have that. Just go and check. You see ineffective breathing pattern, acute pain, and anxiety are common with the disease condition of the heart. Are we following? So when you get to the exam hall, check for the signs and symptoms. I think there's pain associated with this one, but it's not written. Check for the signs and symptoms. When you see the signs and symptoms, cycle it and derive your nursing diagnosis. If the signs and symptoms are not given, check, is it an inflammatory condition? If it is an inflammatory condition, it is a giveaway, because you are going to be having what? Pain, you're going to be having hyperthermia, and you're going to be having what? Anxiety. It's not inflammatory condition. The signs and symptoms are not given. The next thing you should ask yourself, which system? Is it cardiovascular system? Is it respiratory system? Is it digestive system? From that, you'll be able to know, okay, let me just do guesswork and drop. I know you don't do guesswork in the real sense of nursing. You don't guess. But in exam, we don't have to leave our book blank. So you have to write something. So that is how to create a good nursing diagnosis. If there is any question, we will be analyzing the nursing diagnosis on our group chat today. For those that have not registered for our Telegram class, you have been missing a lot. So all you have to do is send a message to the WhatsApp number showing on your screen to participate. It's Always interesting. We go there 8 p.m. daily to take our students' question. Don't worry, you are going to have fun while learning with our voice notes. We have voice notes for the cardiovascular system, respiratory system, digestive, all systems. They have their individual voice notes, including community health management and research. So you see, you are missing a lot if you have not registered for our Telegram class. Thank you very much for watching our video. Thank you very much for staying tuned. Don't forget to share with a friend if you got value. See you in our next video. Bye.